Does your child snore or is hard to wake up in the morning? Do they have difficulty concentrating or seem a little bit too old to still be wetting the bed? Well, they could be suffering from sleep-disordered breathing or sleep apnea. And that brings me to today's topic on sleep-disordered breathing in children. Hi, I'm Peter Miles, an orthodontist, and I aim to give you the straight talk about orthodontics. Pediatric or children's sleep-disordered breathing includes the 1 to 4% of children with the concerning condition of obstructive sleep apnea, or OSA, where there is intermittent and complete airway obstruction. The child stops breathing. Now, the potential consequences of sleep-disordered breathing, and in particular sleep apnea in children, is that it is associated with bedwetting, poor growth, hyperactivity, heart problems, and impaired mental function affecting their grades. Diagnosis of sleep apnea is confirmed only by polysomnography, which is a special overnight sleep study test conducted in a hospital or sleep study centre. But the good news is there's a simple screening questionnaire which is quite effective at detecting children at risk of sleep-disordered breathing, and in particular at determining those who are not at risk. Now, although it is not a definitive test, it's a simple and relatively effective start. A positive score identifies about 80% with sleep-disordered breathing and 40% of those with the more severe sleep apnea. If the child returns a negative test result, there's only a 1% chance of them having sleep apnea. There are a number of risk factors for sleep apnea in children, including enlarged tonsils and adenoids, but also childhood obesity. And for this reason, in children who are obese, as with adults, losing weight can reduce the severity and is recommended as part of their treatment. In fact, it's been estimated that up to 45% of obese subjects may suffer from sleep apnea. And also a 10% reduction in body weight has been shown to result in 25% improvement in apnea. So if your child snores, has trouble concentrating, or exhibits any of the other symptoms mentioned previously, then download the questionnaire from our webpage. If you answer a yes to 8 or more questions, then this indicates your child is at risk of sleep-disordered breathing, and you should seek a consultation with a pediatrician or an ENT or ear, nose and throat specialist to have it assessed further. Also, feel free to share this with friends and relatives with young children or ask questions. Thanks for tuning in. I'm Peter Miles, and see you next time for more straight talk about orthodontics.